The Greater Accra Regional Hospital is struggling to contain the increasing number of critical and severe COVID-19 cases being reported at the facility. This is in spite of the recent expansion of the COVID-19 treatment center, which increased the bed facility at the place from 8 to 16. Now, JoyNews' Manuel Kranting, who visited the hospital today, reports the facility is actually battling to keep a steady supply of oxygen due to the huge demand by patients on admission. Although the main Ridge Hospital has a dedicated oxygen plant, supply has yet to be extended to the COVID-19 treatment center. Here is the medical director at the Greater Accra Regional Hospital, Dr. Emmanuel Srofenyo, who says the continuous delay in securing a dedicated oxygen supply is hampering the effective management of COVID-19 cases there.
Had to expand it to 16-bed ICU currently. That's COVID ICU currently. And as we are talking now, all these 16-bed ICU beds are occupied. And one of the critical needs of patients like this is oxygen support. So they have to depend on high volumes of oxygen. As the technical people have said earlier on, very critically ill patients need about 15 liters of oxygen a minute. So you can imagine that every minute they need about 15 liters. So that means that in 4 minutes, they need about 16 liters of oxygen, So this is oxygen. Before, when we buy oxygen about 25,000, it lasted for some time. And now, 2 to 3 days is finished because some of the patients have become oxygen dependent and they are consuming high volumes of oxygen. So we have gotten to a situation where we are spending a large part of our internally generated resource on purchasing this oxygen. So we've now realized that our oxygen plant, we have a plant, so the oxygen plant can be connected to the ICU block so that instead of buying oxygen in cylinders, we can just connect that plant to the block and have free flow of oxygen in 24 hours. The other danger in relying on oxygen cylinders is that when you have a situation where there is a shortage, maybe cylinder supply finishes before you have to install. If you have patients who are critically ill, in that changeover period, you may lose a patient. And so when we have a situation of continuous supply, it's better than a situation of having to rely on oxygen cylinders. And so that is why we've done the technical analysis, and we are convinced that the way to go is to connect our oxygen plant to that block. We do have estimates in terms of the components. Like there are several components of the work that should be done, and then there is the issue of the pipes, and then there is the issue of the manifold systems that will be connected, and so on and so forth. So that's how the work, and then the workmanship. So we have all these. It comes to a little under 400,000. We are also going to write to our superiors on this, but then again, we know the government has supported us a lot. Some of the equipment there were equipment that was given to us by the government. Any support from the private sector will be welcomed.
We've gotten a very loud communication.
Yeah.
The best has included the ICU beds that have to wait almost always in this communication. Does this situation in any way hamper the efficiency of operating that?
Not at all. What it causes is huge resource expenditure. Huge resource expenditure. So if we are able to get a direct connection, then the hospital will save a lot of money. So the efficiency of the place is guaranteed, provided we continue to supply the oxygen cylinders in good time, which is what we are doing currently. But we have a situation where
possibilities of momentary,
it's always present. So it takes hard work to make sure that you are looking at the gauge, and when it's coming down, you place the order. So when you have a situation where the suppliers are not unable to supply in good time, then you experience shortage. So the factors are many. You get me?
That's the medical director, Dr. Strofenyo, there. He also says that the hospital is set to begin testing of samples at the facility.
Now, another thing that also compromises the bed space is delay in getting results. But government has responded to this. So as we are here now, government has given us a machine that can also test for the COVID. So that being the case, so we will be able, when the patients arrive to our emergency, and we have an algorithm that we use to determine whether it's a suspected case or not. So when the patient arrives at the emergency, and we take the patient through the algorithm, and we deem the case as a suspected case, we'll do the test there and then, and within few hours, we'll have the results, and then we know where the patient should be placed. This is going to reduce the need for holding, because currently we keep patients on the ward as holding for a long number of hours, and this situation is going to stop once we start operationalizing the machine. The machine has been installed, so we are going to start barely by tomorrow. We'll start doing our own internal testing for the sick patients. When they come to the emergency, we will test them early enough, and so we'll have a situation where we will not need a huge space for holding of cases. Yeah.
Good to know that. Okay, so it means that we're not testing, but we don't test yourself.
We don't test ourselves. We take the samples and have to send to Noguchi or Kolebu Teaching Hospital testing lab before we know the results. So that is what is happening. There is a delay.
Testing lab here.
Yes, now we are going to have a testing lab, and government, this device, the equipment came from government. Government has supplied us with the equipment through the Ghana Health Service. We have finished installing it, and so we've done the necessary testing. We've tested some few cases, and the machine has performed well, and so we are going to now start testing of the emergencies. We'll focus on the emergencies that arrive at our emergency departments.